Hello, everyone. Welcome to the world of cardiology, the study of the heart. This is Dr. Jaitly. In this section, I'll be talking to you about very briefly the fundamentals of answering a question: what is coronary angiogram? Well, time and again, one has heard that, oh, my brother had it, my uncle was recommended, or my father had it, or you have been recommended to have a coronary angiogram. So obviously, that's a question that rings in mind. And what is it? What does it entail? How does it help? And what the procedure requires and of you, etc., etc. So we'll try to answer some basic questions here. Again, people, medical students, residents, and fellows, of course, who are seeking more knowledge to improve, this may be just a basic step perhaps for them. But the very fact that I'm talking to you about the fundamentals of the procedure, I'm sure you'll appreciate my time into this, where I am mainly attending only to the procedure, and it's mainly for an educational purpose. So it's a procedure where a dye is injected via a very small straw-sized catheter, which is advanced from a femoral artery or from an artery in the leg. Increasingly now it's being done from the brachial route or the brachial artery route that is in your arm, and that's becoming very popular. So the catheter, which is a small straw-sized catheter, is advanced up into the descending aorta. And as it is advanced under purely X-ray vision, which is called fluoroscopy, the catheter slowly is advanced very cautiously right within the lumen of the aorta, comes up into the arch of the aorta, and then finally descends into the ascending aorta till it is reached into the coronary ostium openings, which means where there are two openings in the three valve leaflets that are at the mouth of the aorta, which is just about to begin from the left ventricle, as you know, if you recall the anatomy I defined in the previous video presentations. So the two coronary openings, or the ostia as I call them, they are engaged. The catheters are engaged one at a time, and the dye, which is the radiopaque dye, is injected and the tree lights up. I call it the coronary tree lights up, in a way that the dye will flow through the coronaries and will reflect exactly if there is any blockage. So what is the procedure? The procedure is a dye injection by a very small catheter-sized tube, advanced slowly from the descending aorta up into the arch and then into the coronary ostia to be engaged so that the dye can be injected and the coronaries can be visualized. Now simultaneously one can also visualize the left ventricle function, its size, as also you can assess what's going on with the aortic valve per se or with the mitral valve too. So there are a lot of other functions that can be assessed besides a coronary tree mapping, if you will. But that's the commonest indication, obviously. For a coronary angiogram, one likes to see what the coronaries are. So you could do the right coronary first and then a left coronary as well. Now, what is interesting is the two coronaries will, as I said, light up, quote unquote, with the dye. And while the heart is obviously moving and you're awake, you can see it while you're on the table and the procedure is being done under local anesthesia. It's very, very mild sedation sometimes. The catheters are engaged here in the openings, and as the dye gets injected from one coronary to the other, one can see if there are any blockages. Now, if they determine the blockages at that point, they may decide, the interventional cardiologist who is performing the procedure in the cath lab may decide and recommend that, look, there's a blockage here, there's a blockage here, or there's a blockage here. Or there are several blockages, unfortunately, we can't do anything about, or they're very, very distal or diffuse or very difficult to get to. Therefore, we'll recommend bypass surgery. So a lot of information can be arrived based on what a coronary angiogram looks like at the end of the study of the procedure. The procedure normally takes by itself 15 to 30 minutes. It does not require hospitalization. You check in early in the morning. You have to be empty stomach. In other words, you can have maybe a sip of water too in the morning if you like, or take your meds if you've been recommended to. and then go in and get your, they start an IV line, they bring you into the cath lab, and they will give you local anesthesia in your groin artery area or in your brachial artery area, and then initiate the procedure like I just defined. So the whole procedure should take, as I said, 15 to 30 minutes. However, after the procedure, you're required to lay in bed, if it's done from a femoral approach, with a small sandbag on the groin artery resting like a baby there. The reason is because you certainly want to have good hemostasis and a good control, because obviously once you begin to walk, you just want to be sure that that's healed well. So normally it takes about a few hours, maybe 4 to 6 hours roughly, to be watched while you're in the hospital laying in bed with that so-called sandbag sitting on your groin area, to compress on the artery and make sure that it is nicely healed. But if it's done from a brachial artery, it doesn't even require that much of monitoring, because you could be walking around, going back and forth to the bathroom, or sitting by the window, etc., watching TV, or you could be discharged the same morning. Now, so in other words, nobody is really admitted these days for an angiogram. You're just checked in the morning, you get the procedure done, and the same afternoon you could be home. Now, if they recommend a transluminal angioplasty, which is called PTCA or PCI now, percutaneous coronary intervention, if they recommend a PCI, which is a stent, or they recommend a bypass surgery, then you continue to stay in the hospital for a day or two for the PCI, and of course for the bypass, maybe 5 to 7 days. But even that is now becoming shorter. So in a nutshell, a coronary angiogram I would consider as a minor procedure done under local anesthesia as an outpatient, where a catheter is advanced, a dye is injected, and coronaries are visualized. It's an absolutely a safe technique. Again, small minor complications are always there, and those are listed elsewhere in various textbooks and journals. You can refer them to, or on various other websites. But my recommendation is that it is a very, very safe procedure in good hands, and obviously done at good reputable medical centers. It gives a whole dearth of information, because certainly allows the interventional cardiologist to understand what your coronary tree looks like, and or if there was any suspicion, which could be treated right there or thereon, or you could be recommended for bypass surgery, or may not be recommended for bypass surgery, etc., etc. So, and of course, the heart function, the valves, and on the left side, which are very important, mitral and aortic valves, both are also determined as far as their functions are concerned. Okay, hope you enjoyed this section, and many, many more later. See you again. Bye.